Three.
Yes. So just share screen.
Share your screen and it should be one of the windows that's currently pulled up. It's not a Parks Commission night, is it?
No, it is not, but I want to know about this.
Okay.
I don't
No,
know.
you're welcome to sit at the table.
Oh, I am?
I don't think
Yes.
we'll fill up.
Okay. I didn't know if you got voted on to the table.
Well, they'll accept me, they'll accept anybody.
Yeah.
Really?
You're voted.
You voted in under the table.
All right, welcome. Thank you for coming. My name is Alex Purse and I'm an affordable housing program specialist with Thurston County. I run CDBG largely alongside some other things. Tom Webster is also here. Do you want to introduce yourself?
Yeah, Tom Webster. I am the program manager for Thurston County's Office of Housing and Homeless Prevention.
So we are the CDBG gurus.
That's right.
Like it. Own that.
I say that term loosely. Yeah, so we're just here to talk about CDBG, what the program is, what activities or how to qualify, find an eligible activity for this upcoming funding year. Feel free, since we're a small group, chime in anytime you want. If you got any questions, you too.
We want to do introductions, might as well.
Oh, yeah, sure. That's a great idea.
Hi, want me to start?
Sure, go for it.
I'm Emily Ecker and I am here because I am a grant writer writing for Rebuilding Together Thurston County. So I have not been through this grant before.
I think we've emailed a couple of times.
Yeah.
Awesome. Great. Nice to meet you.
I'm Wendy Goodwin. I'm like. I am a park commissioner, Lacey Parks Culture Recreations Commissioner, and I also volunteer at the Thurston County Food Bank for Lacey.
Great.
So, and yeah, I network a lot, and I also work at the free clinic as a volunteer in Olympia.
Nice to meet you.
Thank you.
My name is Michael Dennis. I'm the volunteer and training coordinator for the Crisis Clinic. And I'm also the board president for the Oshawa Community Cultural Center.
Thanks for coming.
I'm Steve Robinson, retired about 3 years ago to write books and instead so far got on about 12 different boards. And one of them is the medical equipment bank, and they asked me to be here today.
Great. Nice to meet you. Thanks for coming, Steve.
I'm on, excuse me, I'm Anastasia Everett. I work with the city of Olympia and do the CDBG program there. And I'm here to learn some tips on onboarding potential subrecipients. So this is something I hope to bring to Olympia.
She also knows a lot about CDBG. If you have any questions.
Not
for
as
her.
much as he does, but a little bit.
And I'm Shannon Pilly Fong. I'm the Assistant City Manager for the City of Lacey.
Awesome. Well, thanks for coming. Glad to see everybody here. All right. So here's just a brief agenda. Everybody got a copy of the slides for taking notes, and there were a few links in there that I wanted y'all to have just so you don't have to write them down. So today we're going to go over kind of what CDBG is, the national objectives and eligible activities, then specifics about 2023 funding, how to apply for Zoom grant for funding, and then we'll just have open question and answer.
Is this available by email?
Yeah, I can also email it to you, definitely.
Thank you.
Yeah, just make sure, I'll get your email address. Okay. Yeah. All right.
And Alex, just for some people who walked in, we are also recording this. So there'll be a copy available on the city's YouTube. So feel free to forward that on to anybody else who might need this information.
All right, so what is Community Development Block Grant, CDBG? Their mission is to promote the development of viable urban communities by providing decent housing, suitable living environment, and expanded economic opportunities, principally for persons of low and moderate incomes. So it's a federally funded grant through the Department of Housing and Urban Development. Nationally, it runs nationally and it reaches about 7,500 communities each year. Thurston County is designated an urban county entitlement community, meaning the county gets the funds from HUD directly, and then we then disperse the funds among subrecipients. This entitlement community includes the cities of Lacey and Tumwater, and then also the Southern County jurisdictions. And that funding rotates on a yearly basis. So this upcoming program year of 2023 is for projects and activities in the city of Lacey. And this excludes the city of Olympia, which is why Anna has a job. They are their own entitlement community. So she runs the programs that run in the city of Olympia. So there are 3 national objectives for CDBG, and every activity has to meet one of these national objectives. The first one is to benefit low and moderate income persons. HUD defines low to moderate income persons, which you'll often see as LMI, as people who have an income of 80% or below. And that the definition or the numbers for that, they provide it for Thurston County as a whole based on the income and pricing of living, cost of living in Thurston County. And they update those annually. So I have the table of that information if you're curious about what those numbers are. And 70% of funds must be spent under this, or the activities must be spent under this national objective. So of the activities that we fund every year, 70% of those activities have to be for this national objective. The second national objective is prevention and elimination of slums and blight. This can be on an area basis, which means there's like a large, substantial number of dilapidated buildings, or what's the word? Deteriorated buildings, and funds can be used to do things like demolish them, put up parks in the place. Or it can be on a spotlight basis, which means there might be a certain area that had, well, not an area, but eliminate specific conditions that lead to slum or blight. This, we don't ever really fund anything for this national objective. Is that correct, Tom?
Yeah, we haven't.
Yeah.
Welcome, come on in.
Is this for the? Yeah,
CDBG.
welcome. So this is not a common objective. Thank you, Tom. Not a common objective that we're funding activities for. But the third national objective is for urgent need. This addresses a serious and immediate threat to health and welfare of community. And we can fund for urgent need if there's no other funding available. So this is things like national disasters, pandemics, those kinds of things. So we also have never funded urgent need.
Nope.
Nope. Thanks. So like I said, every activity funded through CDBG has to meet one of these, and it's principally benefit low, moderate income persons. So since that is the principal national objective that we fund activities for, there are 4 different ways that you can meet this national objective, excuse me. The first is area benefit. Area benefit means there is a specific area where principally, so over 51% of people living in that area are low to moderate income, and the activity that would be funded in that area is available to that area in general. So it'd be open to people living in that area. And since over 51% of them are LMI, then that activity could be funded under area benefit. Overall, the city of Lacey does not apply because the city is not principally LMI. However, there is one portion of the city, and I'll move this, that does qualify as a qualified census tract. It is this area here. So in order to qualify, let's say an example of if you wanted to fund an activity in this area, it could be like a park that was principally serving a local neighborhood, like people in that area would walk to it and use that. So then you might be able to say that developing that park is principally what's the word I'm looking for? Principally geared towards an LMI area. Does that make sense? I know all this can be kind of confusing, so if you need clarification, please ask.
They don't have to be in the city, right? Like Johnson Place, for example, be right outside of the city limits.
This year it has to be within city limits of Lacey. Correct?
Yeah, and so that's really a determination for the city of Lacey.
Okay.
In terms of how, because it's their funds, and so the intent, and Shannon can speak to this, is primarily to benefit residents of the city of Lacey or businesses located in Lacey. So if it's in the urban growth area, that's really gonna be up for the city of Lacey to determine if that's a project they want to support, whether it's eligible or not. We can tell you whether it's eligible under CDBG, but then it's really for the city of Lacey to determine whether they feel that's sufficiently supportive of their community.
Yeah, it was well said, Tom. And so, just to reiterate, the preference is first for services that are provided in the city benefiting individuals who live in the city of Lacey. And those preferences are outlined in the RFP. So certainly take a look at that document for more information on that.
Thank you. Did you have something you wanted to add?
Nope.
Okay. Second way to meet the LMI national objective is serving the limited clientele. There is a list of presumed LMI populations, which will be on the next slide. This is, so if you have an activity and you're serving a population that is specifically LMI in any capacity, that would be limited class. How you would qualify under limited clientele. Excuse me, I just took my law.
Sorry, I should warn you, the chair have a tendency to do that.
And a lot of, you may have to document income of participants in order to qualify under this category to show that the beneficiaries of the activity are LMI. The third category is low mod housing. So if you have a housing activity, it needs to be principally available to low mod individuals. They're different numbers. So if you have 1 unit, it must be available to low mod. 2, half of them, 3 or more, 51%. And then low mod jobs, creating or retaining permanent jobs for which at least 51% will be made available to LMI persons.
Okay, question?
Yes.
Sorry, ma'am. So we we do critical home repairs for individual homeowners. If a homeowner qualifies under, I'm not exactly sure if we're under limited clientele or low mod housing 1 unit. But if a homeowner qualifies income wise and is within the city of Lacey, but not within this purple area, does that work?
Yep.
Okay, so the purple area just basically means if you're gonna do,
Area benefit,
okay, like.
Something that's gonna serve a broader
Okay, got it.
community.
yeah,
You.
and not necessarily on an individual basis. Right. All right, so presumed LMI populations, I'm not gonna read them all, but you can see them here. So if you have an organization that serves primarily one of these groups, then your activity may qualify under presumed LMI population.
And just to kind of add to that, that activity needs to be intended for that population. So it can't be, a library. Well, a library serves elderly persons, but it's not intended specifically for elderly persons, where if there was a senior center or senior program that's specifically to serve elderly persons, then that would be eligible. So just because a program may serve some of these populations does not make them, that program needs to be primarily intended to benefit that presumed population, not just part of the general public.
So one of the questions I have is as the crisis clinic becomes more, we expand our outreach because we had to really contract because of COVID. We couldn't do a lot of our community trainings and different things like that. So if we were providing suicide prevention trainings to this clientele, would that kind of fit into presumed LMI populations. If we did it at a senior center, and we do have a program where we're going to be doing it at every high school and middle school in Lacey.
So if you're doing it at every high school in Lacey, so that's not a presumed population,
Okay.
Students. So that wouldn't qualify. If you're doing it at senior centers,
Mhm.
then that would kind of qualify. And so you might be able to say, you can figure out in a sense by proportion.
Mhm.
So if we're doing this program and we spend 20% of our time serving and working with elderly persons, therefore you may be able to justify that 20% of your program costs would be eligible that we could cover. So there needs to be some documentation around that. But you can basically determine what proportion of that presumed population or LMI population that we're serving. And then you can do that. So for an example, we've done that with, one example I'll give is the community kitchen. That's open to anyone, but it's, presumed to serve primarily folks who are experiencing homelessness. And so Catholic Community Services, who's run that, is able to say, based on some surveys they've done, they can say 80% of the folks we know are primarily, that's a presumed benefit. It's intended for that population. Therefore, we can cover up to 80% of their costs.
Mhm.
Seems like similarly that it would apply to the medical equipment pay, which is primarily intended
For seniors,
for,
for low mod.
it's under the senior area agency on agency, but it's but it's intended for low to moderate income folks.
Yeah,
I used it when I just had spinal surgery not long ago, but I could afford to go elsewhere, but so it's for everybody, but it's primarily intended for low income people. It's free equipment from wheelchairs to, canes and all kinds of things.
yeah, and so Alex will get into, so the difference is if it's a presumed population, you don't need to document income. So you won't need to collect income. So if you're serving abused children, you don't need to go to that family and say, prove to me that what's your income and ask for that information. If you're serving a general population, then you do need to document income. For example, the food bank, the Lacey Food Bank, and CDBG has supported the food bank in the past. We go and then monitor the food bank, show us, we're gonna say, here's a list of your clients, they document income and they collect income information. And we're able to look at that and say, okay, a majority of our clients meet this income threshold, but the food bank needs to collect information on those clients to demonstrate their low income. If you serve a presumed population, you don't need to collect that income information. So that's really the distinction. So there's a benefit from an administrative point of view. If you're serving a presumed population, it makes it administratively easier because you don't need to collect income information.
Okay, thanks, Tom. So yeah, like Tom said, if you do if you're not serving a presumed population, then you will need to document income. There are a number of ways to do that. And if your agency needs to do that, then we can have a more in-depth conversation on how that would be suitable for HUD's requirements. But to get started, you definitely need to know what the income threshold is, which is published every year by HUD, and know the definition of how income is calculated, which these regulations. But again, if you feel like that's relevant to you, definitely reach out and we can discuss that in more detail. Also list other ways to do that. So yeah, annual income of household. And then if the household qualifies for Section 8, for example, or another stringent income requirements, then that would be another way to prove that. There are 4 categories of eligible activities. Public services. Activities like this can include things such as like career development, health services, substance use services, child or youth care and education. So these are things that aren't infrastructure or housing. These are things like scholarships for low-income students to attend after-school care, things like that. A maximum of 15% of the annual award grant that we get can be used for public services. So for Lacey, they'll be prioritizing public services that are held by organizations within Lacey that are serving residents of Lacey.
That was $185,000. Okay,
I have the funding amount somewhere in here, yeah.
correct.
And these cannot be used to replace local or state government funds. And they also cannot be used for income payments. Second eligible category of eligible activities are public facilities. So these are facilities that are owned by public or by a nonprofit and open to the general public. If you are leasing whatever facility, a 15-year lease is considered ownership by HUD. So like if you need a new roof on a senior center, for example, you would have to, if you had a 15-year lease, you didn't own the building, we would be able to replace that roof. If it's eligible, that is really just so we don't, HUD doesn't want to put a new roof on a leased building and then that lease ends the next year and then So these eligible activities could include acquisition, construction, rehab, installation, or facility improvements. So infrastructure improvements, improvements to neighborhood facilities, or facilities for persons with special needs. Public facilities and eligible activities would be general maintenance or repairs, operating cost, or equipment purchases. Another category is housing. These activities can include homeowner rehab, down payment assistance, rental housing acquisition, repair, or rehab, and then housing services such as counseling, energy audits, and inspections. CDBG funds cannot be used for new construction, ongoing mortgage or income payments, or payments for construction equipment. And then lastly, economic development. Activities can include acquisition and rehab of commercial industrial buildings, technical assistance for businesses, micro enterprise development, job training, or commercial rehabilitation. This is not typically an activity that we fund, but it is an eligible activity category. So if you have more questions about that, just get in touch with us. All right, so this year's, 2023's available funding, the minimum that can be spent for capital projects is $873,000. The maximum for public service, so that's the 15%, is $180,000. And total funding available is just over $1 million. That includes some key dates. Applications by noon, that's important, on March 31st. City of Lacey City Council will meet and go over applications and review and decide what they would like to fund. That will be in May. Go ahead.
Will City of Lacey have applicants come and do a brief presentation? Will that?
That's certainly the thought at this point in time, is that there would be an opportunity for the recommended funding to have a presentation in front of the Lacey City Council. And so we have a tentative date and it's included in the packet. And certainly once we have solidified that, we'll let all applicants know.
Thank you. June, Board of County Commissioner approval. July, we will submit an annual action plan, including the projects that were selected. Then the county will receive the money from HUD in September, and then contracts for public services can begin in October. For capital projects, an environmental review is required, and those can usually take some time depending on the project. So we have it. Depends on your environmental review when those projects can begin.
And I'll add for public services, those contracts are 1 year. So we do require you to complete that by August. That contract will end August 31st, 2024. Because we have that 15% cap and that's based on what we expend each year, we can't allow the public services to drag out past that August 31st, because that would impact Tumwater. Then would not be able to spend 15% of their CDBG on public services projects. So public services will be up to August 31st of 2024. Construction projects can last beyond that 1 year. However, there's a broad requirement in terms of how we have to spend our money. So we don't like projects to drag out for 3, 4, 5 years because that impacts our ability for other communities to receive funds. So, but capital projects do tend to take longer past that 1 year.
What's your feeling about renewal grants? Are you gonna get this money in years to come?
Yeah, so for renewal, for the way we're set up is Thurston County gets this money every year, but we rotate the funds. So this year Lacey's receiving the funds. Next year Tumwater will receive the funds in South County. So it's hard to do renewal projects for this because each jurisdiction gets to select the projects they want to fund. So certainly for an example, the Boys and Girls Club is a project that each jurisdiction has funded, but Boys and Girls Club needs to apply every year and go through that competitive process. So there's not an automatic renewal or a simplified process for renewing projects.
Does Olympia CDBG happen annually or every 2 years?
We're annual with our CDBG program and we run on the same program year because we're in a consortium. So we have an RFP open right now and it's the same timeline.
Factors to consider: choice limiting activities. So this can include the acquisition of property that you intend to use for CDBG before you've completed an environmental review. So if you do something like that, then HUD will say, sorry, you made this choice limiting activity and we can no longer fund your project. It also includes if you own the building already, if you begin work or sign any contracts before a NEPA environmental review has been completed, then that is also considered a choice limiting activity. Make sure you plan for relocation if tenants or people who are receiving services in your building need to be relocated. Also, if it's a construction project, plan for Davis-Bacon and prevailing wage requirements for federal requirements. And then to ask yourself if your organization has the capacity to manage a federal grant and navigate all of the requirements that come with these funds. Okay, any questions about CDBG in general before we kind of dive in?
Can you define I'm not clear on what is not considered a capital project under this. Is it the,
Anything that's not a public services project is a capital project.
okay, so I'm still unclear where critical home repairs,
It's a capital project.
okay. Even though we're not public.
What do you mean?
Not
by
in
it?
general.
Well, because it's individual homes instead of like a housing.
Yeah, so it would be a housing, yeah,
Okay,
Housing.
got it.
you're serving, yeah, it would be a housing project because it doesn't need to be public housing. This is not public housing we're talking about. This is any housing in the community that serves low and moderate income households. So, yeah, capital is anything services. There's no construction. As soon as there's any improvements, as soon as you swing a hammer, make any improvements to something, yeah, that fits under the broad definition of a capital project.
Okay, so the application for the RFP can be found at this link. You can find it on Thurston County's website. We have a section on our site for requests for proposals. It's on Lacey's website. You can also email me and I can send it to you. Make sure you create a login and select the 2023 consolidated grant application Thurston County. So this is what it will look like once you get logged in. 2023 consolidated grant application Thurston County. I just wanted to highlight here, I know it's really small, but down here you'll see CDBG capital projects and CDBG public service. So you would select either which one is applicable to your project. We do a consolidated RFP, we call it. So we have other RFPs from our office.
And so that first question, by selecting that, you know, the RFP within there, there's probably 50 questions. But by selecting that first one, you'll only see the questions that are applicable to the type of application type of funding you're applying for.
I also want to point out that up top here, there's these different links. There's a library of different documents. So if you click show library, this will come up and there's a number of documents in here to help you complete your RFP. It includes the RFP itself. It includes the consolidated RFP instructions. So this will give you, for each question, it'll give you a list of instructions and information about what that question is asking specifically. There's also Zoom grants, FAQs, in case you need help with this program itself, and then the scoring criteria.
On the scoring criteria, we'll say the scoring criteria do not apply to the City of Lacey CDBG project. City of Lacey will be making their own determinations and using their own criteria.
Never mind. Disregard that star.
The scoring criteria are
Thanks,
applied
Tom.
to services.
If you're interested in other scoring criteria, there you go.
Learn more.
Yes. Okay, that's,
The other thing for Alex to pay attention to is, so you'll go through the application questions, and there's a tab for documents that you're able to upload. And so pay particular attention. There's a couple that you're required to attach, that all applicants are required to attach. Your organizational 501c3 documents, verification that you're authorized to submit the application on behalf of your agency. There's a couple that are required for CDBG, but Zoom grants does not require them because they're not required for all applicants. We couldn't kind of distinguish those. So please pay special attention. We're asking for, especially for capital projects, we ask for project timelines. So some of them are specific to capital projects. So please just look through that list of documents. We've highlighted in parentheses which ones are applicable for federal programs or capital projects or CDBG. So there's, just pay attention to that list of documents that we ask you to attach. You know, especially for the capital projects, we ask for, you know, who's going to be managing this. We want to make sure that, especially if you're doing a capital housing project, we want to know that folks, what experience they have. And there's also an acknowledgement of assurances, which is basically a 3-page list of all the federal rules that you agree to follow. Now, I will say that 90% of those will not apply to your programs, but we have to say that if any of those do apply, you're acknowledging that you will follow the Violence Against Women Act. You will follow all fair housing, all, you know, fair label standards. You know, there's every federal possible rule is in there that you're acknowledging that if something comes up, that you agree that you need to comply with those, and failure to comply can result in you having to repay your grant. So not to scare you, but also, you know, that, and that rarely happens, but it's important to, you know, kind of Alex's last point of making sure your agency has the capacity and willing to take on federal funds, because federal funds come with all the federal rules. And that's, you know, lead-based paint for housing, and there's lots of stuff, so. It's less scary for services. Services tend to be pretty straightforward. It's document, you know, can we document income? Will we, you know, do we have the systems in place? For the capital projects, that's where a lot of the federal, additional federal rules around procurement requirements and things will fall into place. Services, less scary. It's really, the big one is around documenting income.
questions on anything?
So who would we go to? Would it be you in the future if there are questions about, like, for instance, it says no construction equipment purchase or furnishings or personal property? Appliances, you know, we deal with a lot of like broken appliances, have leaked all over, rotting flooring, you know, these kinds of things. Like, is that you who's gonna help us? I mean, that would be after this is all applied for, just to figure out, we don't want to cross any lines and do anything that's not.
We often work with Kathy every year
Okay.
together, yeah, to make sure her the activities that are occurring are eligible and
Okay,
can be covered under cost.
great.
Are you handing out your cards?
Yeah, I brought some. My information's also on the PowerPoint slides. Would you like-
Yes.
Good thing none.
No. I'll do the slide, but then if I give the slide to my
No
my
pressure.
supervisor, then I won't have any.
Yeah. And all my information and probably Tom's information is in the RFP document as well.
And I'll say for the equipment, there's a little more flexibility because you're doing a critical home repair program. There's a little more flexibility for capital projects. The intent is not to, I'm trying to think of an
Or
example.
laptops or something for
Yeah,
an
Oh,
office.
sure. And
Now
now
I
I,
replaced water heaters and those kinds of things.
Thanks.
yeah, and I'm sure Kathy's on top of it, but the more I can learn while I'm here.
right. Especially if something is really attached, installed versus, right, kind of laptop, equipment, laptops are a good one. We had several years ago, again, an example with a food bank, they wanted to buy portable shelving. To store equipment, and we had to reach out to HUD, like, is this counted as equipment? And it was, because it was something that could be kind of basically picked up and moved. So HUD is one of the concerns is they don't want to put money into something that's benefiting low and moderate income people, and then it's easily to kind of bait and switch, right, of that, a year later, well, we spent all this money, we find it's over here in this other community facility that's not benefiting low and moderate income population. So that's really the intent, is that wants to be something that's permanently installed, that we know that there's some degree of confidence that that's going to remain in that facility that's going to serve the intended population.
And I guess the reason I'm here was that I saw that part of this for public, I guess I would fit under public facilities. I mean, we have all of these things going on at the food bank. Public Works, I've talked with Thurston County about an issue that we're having with the transit area, and roads and construction are part of this as well as Public Works. Is that correct?
Potentially.
Okay. So how far does that reach? I mean, would Public Works at Thurston County be the right avenue? Those are the people I'm working with to talk to about Martin Way there.
Yes.
That is, it looks like it's in the purple. I'm
Yeah,
in the purple.
so if that's, and this kind of gets to some of your questions, and Alex and I were kind of thinking about this a little bit more. So one thing, because going back to that presumed benefit, people with disabilities are presumed low moderate income. So if you're doing accessibility features that are intended to benefit persons with disabilities, curb cuts, if you're enhancing accessibility, then those can really be done anywhere, even outside of that low mod area income, because your presumed beneficiary are kind of those people with disabilities. If there's residual benefits, great for your community, but so that's one thing to think about. Accessibility features. A lot of communities like using CDBG for things like enhanced crosswalk features that increase accessibility. So those types of things can be used. If you are doing broad sidewalk improvements that are not just about accessibility, but repaving a sidewalk or something, the question really becomes, who is using those sidewalks? Is this a neighborhood sidewalk that people from Olympia aren't coming on to doing, no one outside of that neighborhood is using those sidewalks on a regular basis? Or is this a commercial district where people from all over Lacey or the area are coming to and parking and then using the sidewalk? So so you've got to ask yourself, who's benefiting from that improvement? Who's the intended beneficiaries? Is it very kind of localized, this population within this low mod census tract, or is it for a broader community?
Is there a niche in here somewhere for publications like we do? We also do senior news. So it's
you know, as part of a public service. And so if there's an education outreach component to your program, yeah, that would be probably not as a standalone activity. But if it was part of a broader activity of providing service. So what is the service you're providing? And then educating and outreach related to that service would certainly be eligible, but probably not as a standalone activity.
Understood. Thanks, Tom.
So how much from year to year or round to round does this, I mean, I understand the location changes, how much do these guidelines change otherwise?
Not at all.
Okay,
So the only change would be
Yeah.
jurisdiction to jurisdiction.
Yes.
okay,
In terms of what they want to fund it, they may
Yeah.
have priorities and whatnot, but these rules that Alex went through have been in place for the last 20 years. And are pretty, you know, they're statutory, they're regulatory, unless Congress really wants to get in there and make changes. They've been pretty consistent.
So I guess one addition to that, the rules don't change, but every year the funding level changes, and that's something to be
Right.
aware of.
but the focus of what you want to fund is basically the same, those categories of. how-
Yeah, this jurisdiction can choose kind of what what they want to prioritize, so. Lacey wants to prioritize housing and those types of activities. But yeah, all those are HUD.
Yeah, South County in past years has really focused on infrastructure and public facilities and less so on housing. Tom Waters' office focused on housing. So it's, yeah, each jurisdiction will select their kind of priorities of what they want to focus on.
If you have any questions later, feel free to email me. We can set up a time to talk if it's more complicated than an email response.
Respond to your emails.
I do. Unless you ask me a question too hard. Thank you for coming.
Thank you.
Thank you. Alex, if you just want to stop the recording.
Oh, we can just
End the
on it
meeting,
there.
actually.
Do we have any